There have been no more confirmed cases or probable cases of Covid-19 in New Zealand, but health officials are ramping up their efforts to stamp out the virus. The Director General of Health, Ashley Bloomfield, says that includes wider testing of people who may be suspected of having it.
We're at that point where we're actively case finding now, and in fact we would be moving to do wider testing of possible or probable cases, even if there wasn't necessarily a travel history or a history of exposure to a confirmed case, but if the clinical suspicion was there. Recalling that we now have an increasing number of countries overseas that are reporting increasing numbers of cases.
As part of that, Dr Bloomfield says the number of tests that can actually be carried out will be boosted.
This week, our laboratory testing capacity will increase substantially as Lab Plus in Auckland is scheduled to increase its capacity from 60 tests per day to as many as 750, should that be required. So combined with the other testing capacity we have in Wellington and in Christchurch and now in Dunedin, we're able to process well over 1,000 tests a day, should that be required.
So far, there have been 5 confirmed cases of Covid-19 in New Zealand, along with 2 probable cases. One of those probable cases was a woman in her 70s who had been on a cruise last month aboard the Grand Princess. On her return, she was admitted to North Shore Hospital with a respiratory illness now thought to be Covid-19, even though subsequent tests have come back negative for it. That's meant dozens of staff have had to go into isolation. But Dr Bloomfield says the Waitemata District Health Board has been able to find people to fill the gaps in its rosters.
The total number of staff who have been asked to go into self-isolation is actually 54. All will need to be well before they return to work. The first staff members were exposed early in the period of her admission, and so will be coming back to work by this Wednesday, the 11th of March, and other staff will progressively return to work, if they are well, as their 14-day period since they were exposed to that probable case expires. And all staff will be back at work by Monday, the 16th of March, which is a week today.
Dr Bloomfield says health officials are also looking at ways to bolster the workforce, including making it easier for retired doctors or nurses to come back to work.
This is a long-haul thing, so we need to think about how might we strengthen or increase the workforce for a period of months rather than just a few days. And one of the things we've actively looked at is bringing in people who might have recently left the workforce, including through retirement. And by way of example, there are 8,000 nurses who have had a practicing certificate within the last 5 years but no longer do. So there's quite a pool of nursing staff. There are 146 GPs who had a practicing certificate in the last year but no longer do. So there are people out there, and this is one of the things we're actively working on to ensure that we could get those people back if they were willing to, of course pay them, but make sure they were registered to practice.
Meanwhile, health officials have now been able to confirm there are 4 New Zealanders currently aboard the Grand Princess, which has been quarantined off the California coast. All of them are crew members. There are also 13 New Zealanders aboard the MSC Opera, another cruise ship that has been turned away from some European ports. However, Dr Bloomfield says the Ministry of Health is not aware of any of those people being unwell. Another New Zealander is on the quarantined Azara on a Nile River cruise, but again, there are no health concerns about this individual. And in the past hour, Australian health authorities have announced 2 schools in Sydney's north and northwest will be closed immediately after 3 students tested positive for Covid-19.